With small testicles, stabilizing them so you can make the incision can be difficult, especially if you are only using 2 fingers. You need to use 3 fingers to keep the testicle in place. Make the incision midline in a prescrotal position. You can do a scrotal incision, however this will make the intradermals more difficult. As it is closed, don't cut through the tunic. If you are unsure whether it is tunic, move the testicle and the tunic will move with the testicle. We now break down the attachment at the caudal pole. Do not be tempted to cut the attachment, as tearing causes hemostasis. Then strip down the fat. I often use Alice forceps to stabilize the testicle, to stop it flopping around while I am ligating. The forceps are placed to create a crush bed. I prefer to use Carmolt clamps. A miller's knot is formed, the clamp removed, and the knot tightened as much as possible, as the tunic can cause slipping. Follow the millers with 5 to 6 singles. When I am tightening, to help prevent suture breakage, I place the suture material parallel in the needle holders. If you are hand tightening, try and knuckle off with your thumbs. This gives a stronger force and tighter knot. With this miller's knot, the suture broke after a few throws. When this happens, I place an additional knot alongside it. This is usually a surgeon's knot. You need to form the knot so it doesn't fall on top of the miller's knot. It is placed side by side to the millers, so you can keep the original compression from the millers. The second crush bed is formed and another miller is placed. As this is a small dog, 2 millers should be sufficient. I cut off the testicle, leaving the golden centimeter behind the last millers. Check for bleeding and then nudge the stump back through the ring. The second testicle is stabilized and the thin facial layers incised. Ensure not to cut through the tunic. Then break the attachment at the caudal pole and strip down the fat using a rubbing action. The testicle is stabilized with Alice forceps. Clamp applied to make crush bed, form a millers and remove the clamp. Tighten into the crush bed and then repeat a second millers. No more than a centimeter behind the first. Check for bleeding and nudge back through the ring. Replace any fatty tissue back, don't fry to cut the fat out, as heostosis has occurred from tearing. Closure consists of a continuous pattern, picking up one side, the middle and then the far side. I tie with the surgeons and then flatten or hide the knot. Otherwise the knot could protrude through the skin later. The knot is hidden by passing it cranial and under the knot, and come out in the intradermal position. I finish with the surgeons, as I feel these are stronger than using an adidane. For burial, use the small hole you left at the end. Wriggle the needle through this hole. Lift the skin over the needle, so it leaves a good distance away. Then pull on the thread and push the skin over the knot with forceps and feel a pop or pull. It is essential the knot is buried. Otherwise it sits between the skin and prevents the skin healing. So when the knot dissolves, it can leave a hole and some wound breakdown. Please support the charity and subscribe for free.